So I'm Dr. Sunil Richardson. We're planning multiple wisdom tooth removal for this patient. This is our orthopaedonograph or OPG. Alright, so I'm going to tell you what we see on the OPG. She has pain in the both lower, right? That's the thing. Now, this is your left side.
Yes.
This side, okay? And so you look at this tooth. This is the tooth that we're talking about. There's infection here. This caries has destroyed the tooth. And there's a lot of food impaction, and if you see the infection has gone a little bit on the roots also. You can see the enlarged lamina propria, so we say. And this is the nerve, right? It's close to the nerve. Okay, it's not far from the nerve, it's pretty close. It just means that the nerve is either before or back, and so we'll have to take a CBCT to know exactly which way the nerve is so we can prevent any damage to the nerve. Now, this is on the other side where you're having the problem. Here the tooth is lying even more flatter. So we have different classifications of these wisdom teeth, okay? So this is what we call mesio-angular, lying mesially, lying towards the opening of the mouth. And then this is what we call horizontal, it's lying horizontal. And then this is, for example, we call what is disto-angular, meaning lying away from the mouth. Right? This is also lying away. How do we say it's the long axis of the tooth? This long axis of the tooth is not perpendicular, forms an acute angle. So here if you see, here it makes a bigger angle, so it's lying towards. Now this tooth, what it's done, here also there's a small caries that's starting on this tooth, on your molar before, because there's food impaction, there's caries here, it's like a fire, it's caught on from this to this, okay? So this tooth will need a restoration later on, a dentist will do that. Now this tooth is not caries, the one that's actually the problem, but it's caused problem on this tooth and it's quite big already. This might need root canal treatment now, right? So this needs to go, this will need a restoration, this will most likely need a root canal treatment. I know on this dentist, they will tell you what needs to be done for that. Now upper, definitely this has to go because teeth work in tandem. Lower one gone, upper one is free, it'll keep growing down on its own. We call it supra-eruption. Supra-eruption, it tends to get down more on its own. Doesn't happen over a few days, but happens over a few months, and for some even over a period of a few years. But eventually what it will do is, it's already, if you see, it's grown a little longer. Can you see that? This is the line of all the teeth. Why? Because this tooth is not in this line. And therefore this tooth tries to grow down to meet its other tooth so that together they can function. But this guy is not functional and hence this guy is also not functional. They work in tandem. So this needs to go. Otherwise, this will cause cheek bite for you in the future. And in another surgery to take it out. Same with this. Not as severe as that, but on a milder grade, this is also the same thing because you see its face is not down, its face is towards the cheek already. Why? Because again, you see this tooth and this tooth angle. See, they're trying to meet each other. This is meeting each other in this way, this is meeting each other in that angle. So nature tries to do that, but it's not a good idea to retain the uppers and only to take the lowers. So the best alternative is to remove, like the best thing is to get everything out in one go. The next option is to take out right side ones and left side ones, because when I do the two, like as you wanted, if I remove the two lower wisdom, anyway you're going to have problems with chewing. Anyway I'm going to give injection on both the sides. Anyways, it's both the sides, so you might as well remove all the four. If you do one side, it's still good because you can use the other side for eating, chewing, everything else, so recovery is slightly more better, right? So that's the overall explanation of your X-ray and your clinical condition. Do you have any questions?
No, it's okay. But so 4 would be better.
I think it's best.
Because upper side I'm not facing any problem.
Correct, that's exactly what I'm saying. It's not caries now, we're not facing any problem, but we're preventing a problem. It's always better to prevent than cure, right? Curing is needed.
Take a long time to heal.
Well, actually, to be very honest, the lower will take more time to heal than the upper.
Okay.
And so it's just like you're just getting it done, no extra, nothing for you. It's just going to take that much time to heal. If you're worried about healing, we could go one side rather than both the lowers, and then wait for a couple of weeks and then go to the other side. But if you have a few days off in terms of rest, I think you can get rid of everything. Then you should go for one side. Because if you do both the more wisdom, you'll definitely need a few days off. You won't be able to work on Monday for sure. Even removing one, you may not be able to work. There will be some swelling. There will be some ooze. Because it's close to the nerve and also because of the position. I will have to cut a lot of bone and remove. It's not going to take much time, it's not going to hurt you. But there will be some, swelling, and those are things which we can't.
That is my left leg.
This is your left.
This side.
Yeah.
So that has been no problem. I mean, that means a lot everything.
Yes, this we can remove in that case. These both we can knock off first up. And then you wait for a few weeks till you are happy, and then we can take this off. Also, when I'm doing all fours for my patients, whenever we do on the local anesthesia and sedation, I tell them, look, we're anyway going to do only one side first. Because what happens, some patients are a little uncomfortable after we finish one side. Then I say, no, that's enough for today. We will do it after a couple of weeks. But if you're comfortable, somebody says, no doctor, I'm feeling good. Just it's that easy, that's it. Do the next thing. Then we do the next one. It really depends on how you're going to take it, and you're going to be conscious of everything. Only that area is going to be now. So we start with left, okay? We plan for these two. At the end of it, I'll tell you, look, this is done. How are you feeling? You're feeling good. You can go for this. This itself becomes a little difficult and you're not feeling up to it. You stop with this two and postpone this for a few weeks later. Done? So, we're going to start with wisdom tooth for this patient. We'll do both the upper and the lower on the left side. So I've just given local anesthesia. That came out like, yeah, we'll give it to you. This is the upper one, this position. So that's why I just came popping out, but okay, now what we'll do is we're gonna show you. I'm gonna show you the two teeth that we removed. Okay. So did it hurt?
A little long.
Not much. When I gave you injection, it hurt you a little bit. Otherwise, no.
No.
Was it sooner that you expected that we removed two? It was. How are you feeling right now? A little bit numbness is there. So you're not going to eat food for a while on that side, okay? Because this full side is going to be numb. Okay, you're going to chew from this side. Okay, so get well soon. I'll see you again after a few days. I've used some dissolvable sutures, sutures that dissolve, so you don't need to take them off. Alright? And after a few weeks, once this heals perfectly, then we'll go for the other side. Good. Right. Yeah, she has assaulted my nerves.